Hypoglycemia, well, it's a condition in which your blood sugar, glucose level is lower than normal. Glucose is your body's main energy source. Hypoglycemia is often related to diabetes treatment, but other drugs and a variety of conditions, many rare, can cause low blood sugar in people who don't have diabetes. Hypoglycemia needs immediate treatment when blood sugar levels are low. For many people, a fasting blood sugar of 70 milligrams per deciliter or 3.9 millimoles per liter or below should serve as an alert for hypoglycemia, but your numbers might be different. Treatment involves quickly getting your blood sugar back to normal, either with high sugar foods or drinks or with medications. Long-term treatment requires identifying and treating the cause of hypoglycemia. Earlier on this channel, I have already posted a short video about hypoglycemia. I hope you have already seen this, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. If blood sugar levels become too low, signs and symptoms can include an irregular or fast heartbeat, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling or numbness of the lips, tongue or cheek. As hypoglycemia worsens, signs and symptoms can include confusion, abnormal behavior or both, such as the inability to complete routine tasks, visual disturbances such as blurred vision, seizures, loss of consciousness. You should seek a doctor's help immediately if you have what might be hypoglycemia symptoms and you don't have diabetes, or if you have diabetes and hypoglycemia is not responding to treatment such as drinking juice or regular soft drinks, eating candy or taking glucose tablets. You should seek emergency help for someone with diabetes or a history of hypoglycemia who has symptoms of severe hypoglycemia or if he or she loses consciousness. Now I'll tell you the causes. Hypoglycemia occurs when your blood sugar, glucose levels falls too low. There are several reasons why this can happen. The most common is a side effect of drugs used to treat diabetes. And now I'll tell you a little bit about blood sugar regulation. When you eat, your body breaks down carbohydrates from foods such as bread, rice, pasta, vegetables, fruit and milk products into various sugar molecules, including glucose. Glucose, the main energy source for your body, enters the cells of most of your tissue with the help of insulin, that is a hormone secreted by pancreas. Insulin enables the glucose to enter the cell and provide the fuel your cells need. Extra glucose is stored in your liver and muscles in the form of glycogen. If you haven't eaten for several hours and your blood sugar level drops, another hormone from your pancreas signals your liver to break down the stored glycogen and release glucose into your bloodstream. This keeps your blood sugar within a normal range until you eat again. Your body also has the ability to make glucose. This process occurs mainly in your liver, but also in your kidneys. Now I'll tell you some possible causes of hypoglycemia with diabetic patients. If you have diabetes, you might not make enough insulin, that is type 1 diabetes, or you might be less responsive to it, that is type 2 diabetes. As a result, glucose tends to build up in the bloodstream and can reach dangerously high levels. To correct this problem, you might take insulin or other drugs to lower blood sugar levels. Coming back to this hypoglycemia, if too much insulin or other diabetic medications may cause your blood sugar to drop too low, that can cause hypoglycemia. Hypoglycemia can also occur if you eat less than usual after taking diabetes medication or if you exercise more than you normally do. Now I'll tell you the possible causes of hypoglycemia without diabetes. Hypoglycemia in people without diabetes is much less common. Causes can include the medications. Taking someone else's oral diabetes medication accidentally is a possible cause of hypoglycemia. Other medications can cause hypoglycemia, especially in children or in people with kidney failure. One example is quinine, and that comes with the name of Quelaquine, that is used to treat malaria. There is a video about malaria on this channel as well. That is very informative. You can watch that video. Okay. And another cause is excessive alcohol drinking. Drinking heavily without eating can block your liver from releasing stored glucose into your bloodstream, causing hypoglycemia. There are some critical illnesses that can be cause of hypoglycemia. Severe liver disease such as severe hepatitis or cirrhosis can cause hypoglycemia. Kidney disorders, which can keep your body from properly excreting medications, can affect glucose levels due to a buildup of those medications. Long-term starvation, as can occur in the eating disorders anorexia nervosa, can result in too little of substances your body needs to create glucose. Well, on this channel, I have already posted a video about anorexia nervosa. That is a very informative video. You can see that video. Okay. And then another cause could be insulin overproduction. A rare tumor of the pancreas that is known as insulinoma can cause you to produce too much insulin, resulting in hypoglycemia. Other tumors also can result in too much production of insulin-like substances. Enlargement of the cells of the pancreas that produce insulin can result in excessive insulin release, causing hypoglycemia. Hormone deficiencies. Certain adrenal gland and pituitary tumor disorders can result in a deficiency of key hormones that regulate glucose production. Children can have hypoglycemia if they have too little growth hormone. Now I'll tell you about hypoglycemia that can occur in some people after meals. Well, hypoglycemia usually occurs when you have not eaten, but not always. Sometimes hypoglycemia symptoms occur after certain meals high in sugar because your body produces more insulin than you need. This type of hypoglycemia, called reactive hypoglycemia or postprandial hypoglycemia, can occur in people who have had stomach bypass surgery. It can also occur in people who haven't had this surgery. Now I'll tell you the complications of hypoglycemia. Well, untreated hypoglycemia can lead to seizures, loss of consciousness, and death can also occur. Hypoglycemia can also contribute to dizziness and weakness, falls, injuries, motor vehicle accidents, greater risk of dementia in older adults. Now I'll talk a little bit about hypoglycemia unawareness. Well, over time, repeated episodes of hypoglycemia can lead to hypoglycemia unawareness. The body and brain no longer produce signs and symptoms that warn of a low blood sugar, such as shakiness or irregular heartbeats. When this happens, the risk of severe life-threatening hypoglycemia increases. If you have diabetes, recurring episodes of hypoglycemia and hypoglycemia unawareness, your doctor might modify your treatment, raise your blood sugar levels. Your doctor might modify your treatment to raise your blood sugar level goals and recommend blood glucose awareness training. Undertreated diabetes. If you have diabetes, episodes of low blood sugar are uncomfortable and can be frightening. Fear of hypoglycemia can cause you to take less insulin to ensure that your blood sugar level doesn't go too low. This can lead to uncontrolled diabetes. You should talk to your doctor about your fear and don't change your diabetes medication dose without your doctor's recommendations. Now I'll tell you some preventive measures. Well, if you have diabetes, you should follow the diabetes management plan you and your doctor have developed. If you are taking new medication, changing your eating or medication schedules, or adding new exercise, talk to your doctor about how these changes might affect your diabetes management and your risk of low blood sugar. A continuous glucose monitor, that is CGM, is an option for some people, particularly those with hypoglycemia unawareness. A CGM has a tiny bar that is inserted under the skin that can send blood glucose readings to a receiver. If blood sugar levels are dropping too low, some models of CGM will alert you with an alarm. Some insulin pumps are now integrated with CGMs and can shut off insulin delivery when blood sugar levels are dropping too quickly to help prevent hypoglycemia. Be sure to always have a fast-acting carbohydrate with you, such as juice or glucose tablets, so that you can treat a falling blood sugar level before it dips dangerously low. If you do not have diabetes, for recurring episodes of hypoglycemia, eating frequent small meals throughout the day is a stopgap measures to help prevent your blood sugar levels from getting too low. However, this approach is not advised as a long-term strategy. You should work with your doctor to identify and treat the cause of hypoglycemia. Now I will tell you about the diagnosis of hypoglycemia. Well, if you use the insulin or another diabetes medication to lower your blood sugar and you have signs and symptoms of hypoglycemia, test your blood sugar levels with a blood glucose meter. If the result shows low blood sugar, under 70 mg per deciliter, you should treat accordingly. If you don't use medication known to cause hypoglycemia, your doctor will want to know the following, which I am going to tell you. Well, What were your signs and symptoms? If you don't have signs and symptoms of hypoglycemia during your initial visit with your doctor, he or she might have you fast overnight or longer. This will allow low blood sugar symptoms to occur so that he or she can make a diagnosis. It is also possible that you will need to undergo an extended fast in a hospital setting, or if your symptoms occur after a meal, your doctor will want to test your glucose levels after you eat. What is your blood sugar level when you are having symptoms? Your doctor will draw a sample of your blood to be analyzed in the laboratory. Do your symptoms disappear when blood sugar levels increase? In addition, your doctor will likely conduct a physical examination and review your medical history. Now I'll tell you the treatment of hypoglycemia. Well, first of all, I'll let you know the immediate treatment. If you have symptoms of hypoglycemia, you should do these things which I'm going to tell you now. You should eat or drink 15 to 20 grams of fast-acting carbohydrates. These are sugary foods without protein or fat that are easily converted to sugar in the body. Try glucose tablets or gel, fresh, fruit juice, regular, not diet, soft drinks, honey and sugary candy. Recheck blood sugar levels 15 minutes after treatment. If blood sugar levels are still under 70 mg per deciliter, eat or drink another 15 to 20 grams of fast-acting carbohydrates, which I have just told you, and recheck the blood sugar level again in 15 minutes. Repeat these steps until the blood sugar is above 70 mg per deciliter. Then you should have a snack or meal. Once your blood sugar is normal, eating a snack or meal can help stabilize it and replenish your body's glycogen stores. Immediate treatment of severe hypoglycemia, I should tell you now. Hypoglycemia is considered severe if you need help from someone to recover. For example, if you cannot eat, you might need glucagon injection or intravenous glucose. In general, people with diabetes who are treated with insulin should have a glucagon kit for emergencies. Family and friends need to know where to find the kit and how to use it in case of emergency. If you are helping someone who is unconscious, do not try to give the person food or drink. If there is no glucagon kit available or you don't know how to use it, you should call for emergency medical help. Treatment for an underlying condition. Preventing recurrent hypoglycemia requires your doctor to identify the underlying condition and treat it. Depending on the underlying cause, treatment may involve medications. If a medication is the cause of your hypoglycemia, your doctor will likely suggest changing or stopping the medication or adjusting the dosage. Tumor treatment. A tumor in your pancreas is treated by surgical removal of the tumor. In some cases, partial removal of the pancreas is necessary. Well, this was my video about hypoglycemia. I hope you like this video. If you have any questions about hypoglycemia, you can ask in the comment section.